Okay, so listen here. You do not need me to look pretty for you to pass your NCLEX. So I'm gonna go ahead and make this video. I'm wanting to make this the past few days because it's been all over the NCLEX, so you have to know this. Pay attention. Save, like, share this out, comment, all the things, let's go. I'm gonna go over the different anemias and exactly what you need to know. No more, no less, no fluff. Anemia means low RBCs and low hemoglobin. So what does that mean? Less oxygen getting to the tissues. So your patient's gonna be pale, tachycardic, short of breath. They're gonna be tired. So always remember, low oxygen means low energy. First one I'm gonna go over is iron deficient anemia. This is the most common, and this is due to blood loss or low intake. Examples could be GI bleed or poor diet. The patho for this is as basic as low iron means low hemoglobin production. Your labs are going to be low hemoglobin, low hematocrit. Biggest thing that NCLEX wants you to know is patient teaching. What foods can they eat that's going to increase their iron? So you're going to think red meat, spinach, liver. You're going to take iron with vitamin C, helps with absorption. Let them know that their stool can be black and they might be more constipated. NCLEX tip, if the question says something about a GI bleed, don't just go throw iron at it and pick that answer. Fix the problem first. Pernicious anemia that is your B12. That is the loss of intrinsic factor in the stomach. Most likely autoimmune or happen after somebody has a gastric surgery. So the patho for this is they need more B12. This is going to help with RBC production and neurofunction. A sign and symptom is something called paresthesia. This is where people have that tingling and numbing feeling, usually in the hands and feet, but it can happen anywhere on the body. Symptom is confusion, imbalancing problems. They're low on oxygen. And the big thing for the NCLEX is these patients have to be on B12 injections, not oral, because orally they will not absorb it. Have to have B12 injections. Lifelong. Next one is folic acid deficiency anemia. This one is common in your alcoholics, pregnant women, and poor diet. Folate equals DNA synthesis of RBCs. So if you have no folate, you cannot produce RBCs. Patient teaching for this is they have to replenish that through their diet. So encourage them to eat their green leafy vegetables. Supplements are readily available anywhere in any store. They can take them. These symptoms are very similar to B12, but they have no neuro symptoms. Still have the confusion, change in LOC, being tired. Just remember that because that's how you tell these two apart. B12, they have neuro symptoms, but with folic acid deficiency, there is no neuro symptoms. The last one I'm going to go over is aplastic anemia. This is caused by bone marrow